Hey everybody, this is Dr. Nathan Everett over at Body Balance Physical Therapy. How are you guys doing today? It's pretty darn hot here in Austin, Texas. It'd be kind of cool to see how everybody else's weather throughout the United States is doing. I've heard that it's actually quite warm, especially up north, like unseasonably warm. So I know it's kind of weird here because we haven't even hit triple digits yet. And so I'm sure that'll be coming in the next few days. But so today we're going to go over shoulder pain. And so shoulder pain is something pretty common that we'll see, especially as we've been sitting down a lot more. We don't tend to reach up over our heads as much anymore, especially as we're sitting down, or if we've been less active, especially with how COVID's hit. And we're starting to open up a little bit more now. But we haven't been able to get out and do the things that we enjoy doing. So if we're not really lifting our arms up over our head, our body doesn't get used to doing that. And so I want to just hop on today and talk to you guys a little bit more about shoulder pain. And if you have any questions during this video or when you're watching this, go ahead and comment below. We'll get back to you and hopefully try to answer any questions that you might have as best as we can over the internet. And if not, we'll try to get you guys in to come on and have an evaluation done by one of our doctors of physical therapy. So first things first is the shoulder is a very complex joint. It's technically called the shoulder complex, which means it is comprised of our collarbone or our shoulder bone, or our collarbone or our clavicle, excuse me. We also have our humerus, which is this big long arm bone. But we also have this the bone in the back of our shoulder called the shoulder blade or our scapula. And all of those have to work together in order to achieve our ability to reach our arm up overhead. And there's a lot of muscles that are incorporated in actually having this done. The only axial attachment, when we talk about that, that's just where it attaches to the skeleton, or we think more about kind of our vertebrae and our rib cage, kind of that whole set of bones right there. The only place where that actually attaches onto that is right here at our sternum. That's what we call our sternoclavicular joint. That's the really only bony attachment that we have from this whole shoulder complex onto our axial skeleton. So there isn't a lot of inert stability coming from the bones there, so it relies heavily on muscles and ligaments and tendons in order to hold it in position. That's just to hold it in this one position, not alone, just trying to get that arm up overhead. So we kind of talked about these bones here, but what we have are the muscles that surround them. We have kind of different subsections of muscles that are working on moving different things in the shoulder. So we have this whole anterior chest, which we think about our pectoral muscles, all these muscles that we use when we're doing a bench press or doing anything, we're pressing anything away from us to get these muscles big and strong. And they actually attach onto the front side here. And a lot of what their course is to do is try to pull that arm a little bit closer into our body in this plane right here, but also turns our arm in. So we have these muscles over here on the front side of our chest. We also have just technically like our shoulder muscles. We think of those like our deltoid muscles, but also, not to really get too much into them, but our rotator cuff muscles. And what they're responsible for doing is being able to seat the head of that humerus or that arm bone into the glenoid cavity, which is the little socket that it fits into in your shoulder. And so it sits in there just like this. And it's not a very deep socket, whereas if we look at our hip really cups around it. And it's going to change from person to person, but it just generally it cups around it. So there is a lot more stability versus when we get into our shoulder, it kind of just sits in here like this. We always use the tee and golf ball analogy, that it kind of just sits on there like a ball would on a golf tee. And it doesn't have a lot of just bony stability. And so it takes a lot of those muscles. And so the rotator cuff is actually going to sit there and it wraps around it and it sucks the head of that humerus into the glenoid. Okay, or that ball into the socket. And it helps it to stay set in there, and that's going to help create some stability within our shoulder. So we kind of think of those as some of our shoulder muscles. Our rotator cuff is comprised of 4 different muscles. So if you've ever heard you have a rotator cuff tear, there isn't just a rotator cuff muscle. It is a combination of the 4, and one of the things that and they all have their own actions. And that's, when you come in to see us for any sort of rehabilitation or strengthening, we're trying to figure out what muscle out of those that we really want to help to focus on to help progress you towards your goals. And so then the other set of muscles we have is what we call our periscapular muscles. And so peri means around. And we're talking about the muscles that are around our shoulder blade. And they're probably some of the more important ones that don't really get too much love when we're talking about going through a shoulder rehabilitation, because it's important because there's this term called scapulohumeral rhythm. And that's kind of a bit of a mouthful, but what that is that is actually the ability of our shoulder blade and our humerus, so our scapula and our humerus, to move in rhythm together. And so what happens is our shoulder blade sits on our back kind of like this, and as we raise our arm up overhead, it sits there and it rotates up. And then when we move our arm back down, it rotates down. And this is kind of important to understand as to why you might be having some shoulder pain, is because as we're sitting with the head of our humerus in that ball, like tell people, there's a little hat that sits over the top, and it's called our acromion process. And you know, it's just a flat bone, and if you reach over here on the top of your shoulder and you feel just kind of that flat bone, I'm not feeling onto my humerus. What I'm actually feeling onto is an extension of my shoulder blade. And so what its job is to do is it sits right over the top of where those rotator cuff muscles insert onto your arm, and helps to give them a little bit of protection, because if this wasn't here, it'd be open to all the elements. Anything could come and it'd fall down on our arm, and we'd be putting a lot of stress right on those tendons. And if we kind of look at how big they are, I mean, they're no bigger than the size of my pinky when they kind of wrap on to the head of my humerus, or what their tendon size is. And so its job is to sit there and help attach, or I guess cover those attachments. And so that's a good thing. We want that. The only problem that we run into is sometimes if our shoulder blade isn't working the way that we want it to, and I guess not necessarily the muscle or the blade, but the muscles around it aren't getting it to roll and go the way that we want it to, that sits right over the top of there. And so when I go to lift my arm up, I can run right into that. And I come back down, and I can run into that and back down. So sometimes people come and say, yeah, when I lift my arm up, it feels fine until I get to about right there. And then it gets to hurting, and then it gets better until I get all the way at the top. So what happens is they're coming and they're lifting, and it'll start to feel better, because then the head of this humerus has to slide down to keep going up. So it's finally relieving some of that pressure. That's a common injury that we'll talk about here in a couple minutes. But so yeah, that's why it's important to get that shoulder blade to move up and down and rotate around, and get those muscles that actually do those certain movements to be able to do that as well. So right now I have an outline of all this stuff that if you would like, after this is done, you can go ahead and comment with your email address below and let us know that you kind of like an outline of the things that we had talked about over the course of this webinar, that we can go ahead and send that out to you. So yeah, so that's, we're also doing this on Zoom at the same time. So I've got a couple people live, so I'm asking them to ask questions as well. But yeah, again, if you have any questions throughout this whole thing, even if you're watching it live, or if you're watching it later on after you've come home from work and you see it pop up on your feed, go ahead and shoot a comment in there. We're going to constantly be looking on those and making sure that nobody has unanswered questions out there. So, so does anybody on the Zoom feed have any questions at all? All right, perfect. So yeah, so we kind of talked about, I guess, just the anatomy of the shoulder, which, you know, that's, most people that come in here, they're not really going to care. If your shoulder hurts, you're like, I really don't care what my humerus is, what my acromion process is, or what my coracoid process is. But sometimes it's just good to have an appreciation of maybe why that might be happening. I know that I'm kind of a visual learner, so if I can kind of wrap my head around what is actually happening, maybe that might actually make me feel a little bit better. And I've actually had some patients tell me that as well, that, yeah, I guess that makes sense, and I can kind of understand my pain. And there's this term that there's a difference between pain and suffering. And suffering is being in pain and not knowing why. So I like to give people as much information as they can, so maybe they can kind of help understand their pain and figure out what's going on. So yeah, so we kind of talked about the rhythm as well, of making sure that that shoulder blade is able to move the way that we want it to. So kind of next thing I want to talk about is just some of the common impairments, or I guess we call injuries, that we might see as people come in through the door. And again, one of the very first ones that we talked about is people are like, yeah, when I go to lift my shoulder up, I can't get this pain. right here in the front side of my shoulder, and it gets worse, and then it finally gets better, but it's still really uncomfortable, and it's keeping me from doing a lot of things. That's a term that we have. It's called subacromial impingement. So it's just an impingement in our shoulder. And again, it has to do with pinching and impingement of the head of those, the humerus underneath that bone, and irritation of some of those muscles and tendons, specifically of our rotator cuff. And so we also have what's called like a tendonitis of the shoulder, or a bursitis. And so they're two different things. They can present the same way most of the time, but there are two different tissues or two different parts of our body that are being injured or having some issues. And so with a tendonitis, a tendon is a piece of tissue that is going to connect a muscle to a bone. And so tendonitis is really just the tendon in an active state of inflammation. That's all that itis means. And so if you ever have a term that, somebody says some word that you don't know, and the last four words are ITIS, or four letters are ITIS, that is just itis, meaning that there's active inflammation. And then there's osis, or tendinosis, which means that there is not active inflammation, but there could definitely be some swelling still. And so most of the time when we see any sort of a tendonitis, it is due to a little bit of overuse of that muscle, and that muscle reaching its necking point, or its, kind of the limitations of the strength that it actually has. And so if it constantly keeps getting bumped into, we can develop some tendonitis because that muscle is being inflamed, and it becomes weak, and then we start using it a little bit more than what it likes to be used, and we can get some inflammation and some tendonitis there as well. And most of the time that's going to happen when you end up moving it or stretching it. You're just going to feel some pain up into that shoulder. But then we also have what's called a bursa, or a bursitis, which is the bursa, which is a sac of fluid which helps to lubricate in between the tendon and the bone, so it's not constantly, that tendon just doesn't sit there and rub on the bone and create a lot of friction. And its job is to sit in there and cushion that, but it can get inflamed and swollen as well, and it's kind of the same mechanism as the fact that there's way too much or too much stress being placed through that area, which is causing it to inflame just a little bit. So they present fairly similar, but for the most part it is due because of an increased use or overuse of that area, which usually means that there's an underutilization of muscles elsewhere, and it's just trying to pick up the slack. And so, our number one goal when you come to see us is to make sure that we're finding the source of your pain and trying to help get rid of it. That's our ultimate thing, because pain is no fun to be in, and we don't want you to have to live in pain. But what's going to help you continue to stay better and not to have this issue again is to figure out why exactly that tissue became more used or had more stress put on it, and try to kind of improve our efficiency of our movement, or the mechanical ways that we move. And so that's kind of, once we get rid of the pain, that's how we want to keep you out of pain, and start to teach your body how to truly move, so we don't have these issues ever again. So another one that we have, or another common thing that we have is a rotator cuff tear. And so this is not necessarily the time or place for this video, but there is some evidence out there that surgery and therapy have about the same outcomes over the course of time when it comes to rotator cuff tears. And a lot of people actually have rotator cuff tears and really don't even know that they have them. It's just by chance they say, yeah, I've had a little bit of discomfort in my shoulder. Let's take an X-ray and MRI, and all of a sudden they're like, well, yeah, your rotator cuff is torn. It happens more often than you would think. But so one thing that's very indicative of that is having some pain at night when you're sleeping. And so that's not necessarily the tell-all that if I have pain at night in my shoulder when I'm sleeping, my rotator cuff is torn. That is not it at all. You can't really ever just have that said and then just ultimately jump to that conclusion. That's very irrational. But that's something that you can come and we can help to diagnose with that. There's a lot of tests that we can do that are fairly accurate. The gold standard to testing to see if you have a rotator cuff tear is any sort of medical imaging, but there's a lot of good sensitivity and specificity with the test, which basically helps us to rule in or rule out whether you have a rotator cuff tear or not. So that's something that you can do. is come in and see us, and we can kind of help to decipher if maybe that is something that you have, and maybe your next course of action while you're doing that. And so, but it can happen in multiple different ways. It can be, chronic over time, that we keep getting that bumping and that tearing, and it's going to get those micro tears, and eventually it's going to create a micro tear into a bigger tear into a bigger tear, and all of a sudden we have a partial thickness or a full thickness tear up there. But it can also be from falling and landing on your shoulder. Anything that might be too much stress or too much resistance on that muscle can cause it to tear. And it definitely, there's some people that have no issues with it, but what it can be is it can lead to a loss of range of motion, loss of strength, and also loss of function. I mean, not even being able to reach your head up behind your head to reach, or to wash your hair or comb your hair, or reaching across to be able to put on deodorant or anything like that. It can be something that's really problematic when it comes to that. But so a couple of the other ones we have are dislocation of the shoulder. That can happen in various different ways, whether it be falling or car accidents or anything like that. But also fractures of the shoulder too. Anything in the arm, the shoulder blade, collarbone, anything like that are things that we are able to help treat if you were to come in with any issue like that. So anybody else have any other questions about injuries, as far as like, yeah, I've had this, or I've been diagnosed with this in my shoulder, or somebody has told me that I've had this going on in my shoulder, or something like that. Anybody else tell them that they've had any issues or any weird diagnoses that they've had? Yeah, usually this is kind of a pretty exhaustive list of what we will see here in the clinic. Every now and then you'll get your unicorn of something that comes in and you're like, man, I've only read that in a textbook. I've never really seen this in actual life. But yeah, this is kind of, when we look at normally what's walking through the door, these are some of the things that we see, and that's why we want to make these videos, so we can kind of give a resource to anybody out there that might have questions. Be like, well, I went to the doctor and he said I have a rotator cuff tear and I might need surgery. Like what is that really my only option? And that's what we want to do, is we want to just try to help inform people of what we can do here with physical therapy, not just here in Austin, but also just all over the world. That we are very well versed in treating any sort of musculoskeletal injuries, meaning that the muscle or any soft tissues being injured within the muscles, ligaments, tendons, or bones being injured, that that we're able to help kind of figure out what's going on. But we also know what's within our scope of practice, meaning that if you have a fracture, I'm not just going to say like, yeah, I can fix that, I can replace that where it needs to go. You don't need to go see a doctor. I mean, we know when we need to go and send out to a physician. That's why our profession has really changed towards more of a doctoral program, and anybody that graduates from most programs now graduates with a doctorate, because we know what we don't know, and we know when to go have your medical physician or somebody else evaluate you, because it's not within our scope of practice. So it doesn't sound like anybody else has any other questions. So one of the last things that I wanted to go over is what kind of things do we do here with physical therapy. Like, let's just say you come in with a shoulder injury, or your shoulder's been hurting for a couple of weeks now. What kind of things will you be doing when you walk through our doors? And like I said, our primary goal and idea is to make sure that you're getting out of pain, because we don't want you to be living in pain. That's the last thing that we'd really wish on anybody, because movement should not hurt, and if a movement that you're doing hurts, old age is not a good answer for that. I used to play sports that, it's just part of the aging process that I'm going to hurt. There's plenty of people that are up into their hundreds that don't have any sort of pains at all. So that kind of puts that theory to rest, that just because you're aging means that you should get pain. So our number one goal is to help diagnose why you are having pain, and help to figure out a course of action to prevent you from having that pain anymore. And then again, like I said, is we want to figure out what's causing that. So maybe that's because you're missing range of motion. Maybe it's just like, yeah, I'm really tight right here. These muscles just won't let me lift up. And maybe we need to help to increase either some strength to lift you up high, or stretch some of the muscles down here that are restricting that motion from helping you get up overhead. So range of motion is one of the big things that we want to work on, is making sure that that joint can move wherever it needs to go, and then try to figure out, well, is it the strength of my muscles that aren't letting me get up to there, or is it the length of the muscles that aren't letting me get to there, and being able to help kind of restore that. But also, if you come and see us, more than likely, twice up to 3 times a week is something that you're going to be coming to see us for. And, if you only work on these things for the 3 times that you come in here, it basically breaks down to every hour, 45 minutes to an hour you come to see us, that's almost about 1% of your waking hours. So if you only come in twice a week, if you only put 2% effort into doing any of this, then you probably can't really expect any good results. So that's where the burden comes on us, is because we want you guys to be feeling better, is that we need to give you guys things that you need to be doing at home to carry over with that. And that's where you're actually going to continue to start to feel better, is doing the things on your own. Our goal is to try to help figure out what the problem is, what's not working right, and what kind of things you can be doing on your own that are going to be safe, that are going to be efficient, that you can help to improve that. Okay? So obviously pain is going to be our number one thing. Range of motion is going to be our next thing, but also, just strength and stretching. I mean, I'm a big believer in that strength can cure a lot of things, and that you can never be too strong, but you can always not be strong enough. And so we definitely want to help to build the strength to be able to get your arm or anything in your shoulder to move, and whether your shoulder, your back, your legs, anything like that, to have the strength to be able to move that. We don't really think about it, but my arm actually weighs something. We think about, I'm lifting weights, that I have to have a weight in my hand to be able to press up overhead or in front of me or pull or anything like that. And my arm usually weighs, depending on the person, anywhere from about, I would say the average person, because more strong man, they're going to be weighing a lot more, but anywhere between 10 to 30 pounds for an arm. And so that takes strength in order to do that. There's a lot of torque placed in that shoulder. And so, making sure that you just have the strength to lift that up. But again, it plays back into that rhythm by making sure that those muscles on the backside of your shoulder blade also have the strength to take on that movement and that torque that's placed on that arm when it's out here, but also be able to continue to smoothly move that shoulder blade up and down as we're moving as well. So again, I'm a big believer is if we have strength and we don't know how to use it, then that strength is useless. So that's where we work on a term called neuromuscular re-education, is being able to teach those muscles how to fire in any different thing or any different way that we might be using it. So if it is lifting up overhead, or if it's, when I go to throw a baseball or I go to throw a ball to my kids, I get the shoulder pain. Or it's if I'm working on pull-ups at the gym, or I'm pushing weight up overhead, is to help teach those muscles how to get into that position, but also help to build up that strength to the weight that you normally do. It's like, I can ask you to throw around a tennis ball, but we know that a baseball might weigh a little bit more. Or I might ask you to, I can have you push up a 5-pound weight or a PVC pipe up over your head. But then if you go to the gym and you're trying to lift 45, 55, 65 pounds up over your head, I'm not really doing you any justice by only putting 5 pounds on you. And so, and then so again, after we get all of that, and we restore that range of motion, we restore your strength, and we restore your neuromuscular re-education, we also want to make sure that you're resilient to injury coming forward. So being able to adapt to certain things, that only not being strong just in one motion, but maybe in some other motions that you might be put into throughout whatever you do for the course of your life. I mean, I think about my kids are super young, and they're to the point now is if I go to pick them up in the air and hold them up, they like to wiggle. They're not a stationary weight, so I have to have good stability within my shoulder and good neuromuscular education and different abilities to change my strength depending on something else that's kind of wiggling around. So if you have kids, if you have grandkids, or heck, if you even have dogs and you like to pick them up and hold them, they don't like to stay still quite often. And so having that strength to be able to stabilize against that object that's moving around is important too. And that just kind of goes into kind of what we were talking about before is, I want to help with your pain, but I also want to help to have this never become an issue again because of this. Okay. So any questions about with what we do here as far as treatments, I guess I would say, for physical therapy. So I had somebody in here ask if I'm in pain, should I continue to move? I would say yes. I'm not a big believer in rest. I feel that, and this is another topic, but if we rest, we're going to lose strength. Our body just doesn't know how to maintain strength and just put that strength on hold. It is constantly just, whatever we're giving it, it is adapting. And it's one of those things, if we're not moving forward, we're moving backwards with our strength, because it takes a lot of energy to maintain strength. And if our body is realizing that, hey, Nathan's not really doing any of these exercises that he was before, that I can get rid of some of that muscle mass because it takes a lot of energy to sustain it. That, that's resting isn't going to help us out at all. It doesn't just know that, oh, well, his shoulder hurts, so maybe we should just keep it around just in case he decides to keep going at it afterwards. And so I would say moving in a pain-free range of motion is going to be ideal. Again, as I said, if you're having pain, pain is not natural. Pain is not normal. Pain is needed, and that's our body's way of telling us that there's an issue and that we need to get it addressed. So does that kind of answer your question? Okay, perfect. Yeah, moving is great, and that kind of is a good segue as far as to what I kind of want to finish up with. It is, what can I do to either prevent issues with my shoulder or to keep the strength that what I have? And my number one thing is exercise. And it doesn't have to be going to a gym. It involves just making sure that we continue to move our arm up over our head and do things like that, whether it is putting dishes up onto the top shelf, whether it's reaching up, pushing your kids up over your head, anything like that, pushing your dog up over your head. Anything can be exercise. Because remember, our arm actually is weighing something. And so it might feel easy, but that's great because that means that we have the adequate strength to do that. But if it's hard, or we're really straining, or it's painful, that's where we're here for. That's what we want to help you out with, to make sure that becomes pain-free. Second one is kind of works into what was continued with full range of motion. Move your arm in all different directions, across your body, up in the air, behind your back, all these different motions to keep it moving. And then my last thing is to not let a campfire turn into a wildfire. And what I mean with that is that we don't want a small issue to all of a sudden just get out of control and become a much larger issue. So like I said, if you're having some pain, or you have been having some pain, that maybe you can keep doing the things that you're doing, but it's painful, that's where we would love to see you at that point. Because realize, if we keep doing it without changing the way that we're doing it, we're just kind of moving into the direction that's been causing the pain. So if we can continue to move it more and more, and also come in and see us and figure out why it's hurting, and help to adjust and alter maybe the mechanics or the strength or the ability to move in those different ranges of motion, we can keep it from turning into a much bigger issue. So does anybody have any questions? I mean, I know it's a lot to fit into, and almost 30 minutes now, and I appreciate your guys' time and sticking with me and hearing me out. Hopefully, I don't like to talk over anybody's head. Hopefully it made sense. And again, that if you have questions on anything that I said today, go ahead and type out those questions down below in our comments, or send us an email or give us a call, and we would love to help you out however we can. So, I appreciate your guys' time again. Thank you so much. We hope to see you guys at some point. Not that we hope for you guys to get injured, but even if you just enjoy what we do, go ahead and like our page. We like to put out a lot of content like this, more and more, just to keep everybody, not just in our Lakeway and Austin, Texas area, but just around the world, informed. So hope you guys have a good rest of your day. Stay well, and we'll talk to you soon. Thank you.